implantable cardioverter defibrillator. This implantable cardioverter defibrillator is a small battery powered device and mainly placed on the chest to detect and stop irregular heartbeats in case the patient has any arrhythmias, and that implantable cardioverter defibrillator, it will monitor the patient hearts and deliver the shock whether there is any occurrence of arrhythmias, and it also helps to restore a regular heart rhythm. Coming to the introduction, this implantable cardioverter defibrillator was first discovered in 1970, and some research had been going on, and in sense mainly it will be signal the atrial and ventricular signals, and it helps to detect and classify the sense signals, and it helps to provide therapy for ventricular fibrillation and ventricular tachycardia. And the pace of form, so mainly it helps to pace in case of cardiac resynchronization. There are two types of implantable cardioverter defibrillator. The first one is a traditional implantable cardioverter defibrillator is implanted in the chest, and the wires, that is the leads, usually attached to the heart, and this is an invasive surgery. This procedure will be performed by invasive surgery. And the second type is a subcutaneous implantable cardioverter defibrillator is another option. So here it will be implanted under the skin, that is mainly on the side of the chest below the armpit, and the electrodes will be attached to the breastbone. So this implantable cardioverter defibrillator is larger than a traditional implantable cardioverter defibrillator, and this one will not attach to the heart. So why it's done? Why you are doing implantable cardioverter defibrillator? Because here it will be constantly monitor the irregular heartbeat, and it helps to correct the arrhythmias, and it helps when the heart stops beating. It helps as a form of in the time of cardiac arrest. So here you can see that implantable cardioverter defibrillator and where it's implanted. So you can see the side of the chest where it's implanted, where it's there implanted. Okay, the lead is implanted, and the battery powered pulse generator is implanted, usually the pectoral muscle on the patient's non-dominant side. So this defibrillator usually delivers a 25 joule or less shock to the patient. And in case the first shock is unsuccessful, the generator recycle and can continue to deliver the shock. And here the healthcare provider may recommend an implantable cardioverter defibrillator if the patient has a signs and symptoms or irregular heart rhythm called sustained ventricular tachycardia or any ventricular arrhythmias. And this implantable cardioverter defibrillator might be recommended if the patient has survived with the cardiac arrest, and even some other reasons also we can recommend the implantable cardioverter defibrillator. So in case the patient has a history of coronary artery disease or heart attack and any weakened in the heart, and even enlarged heart muscle, that is cardiomyopathy, and any genetic heart condition, that is any congenital abnormality that may be a cause of dangerously fast heart rhythms, and any long QT syndrome, and even other conditions that is affecting the heartbeat. And even the healthcare provider may recommend the implantable cardioverter defibrillator for the patient those are having any structural defects, so in the heart, that prevent attaching wire to the heart through the blood vessels. So coming to the risk factors, there are some possible risks of having the implantable cardiac defibrillator. So it will be causing infection at the implant site, and sometimes the patient may develop swelling, bleeding or bruising, and even the blood vessel may damage, and there may be occurrence of bleeding around the heart. It may lead to a life-threatening complication. even the blood leaking through the heart wall, that is regurgitation, where exactly the implantable cardioverter defibrillator placed, and even collapsed lung and shifting of the device or leads which could lead to cardiac perforation. So how you prepare the patient? So before getting an implantable cardioverter defibrillator, the healthcare provider will order several tests. First one is electrocardiography. So it's a non-invasive procedure. It's a quick and painless test that usually measure the electrical signals of the heart. And the electrodes will be placed on the chest. So there are 6 chest leads and 4 lymph leads. So chest leads will be placed on the chest and 4 lymph leads will be placed and wire connected on the electrodes to a computer that display the test result. And the ECG shows whether the heart is beating too fast, too slow, or not beating. And the second one is echocardiography. This is also a non-invasive test. Here we will be measuring the sound waves to create pictures of the heart in motion. So we can also detect the regional wall motion abnormality and ejection fraction of the heart. And the next one is the Holter monitoring. So the Holter monitor is a small wearable device that keep track of the heart rhythm, and it helps to maintain a heart rate if the heart stop, or even the patient is having an irregular heart rhythm or any ECG missed, and here the patient typically wear a Holter monitor 1 or 2 days. So sometimes what will happen, when we are taking the ECG or echo, we may not be knowing exactly when the patient is developing any arrhythmia. So if you are keeping the Holter monitor for 1 or 2 days, we can monitor in between if the patient has developed any arrhythmias or any abnormality in the leads, which will be monitored, and we can start the treatment. So here the voice from sensors on the chest connect to a battery operated recording device that will be carried in the pocket or on a belt or shoulder strap. So even we can monitor the Holter monitor, we can do it in the home itself. And while wearing the monitor, the patient may be asked to keep a diary of his activities and symptoms. And the healthcare provider will usually compare the daily, and if they are feeling any changes of heartbeat with the electrical recordings, and try to figure out the cause of symptoms. The next is the event recorder, and if the patient does not have any irregular heartbeat, heart rhythm at the time of Holter monitor, and even the healthcare provider, even we can alternate measure we can do, that is the event recorder that can be worn for a long time. So there are various types of event records out there, and if you are seeing the event recorder, this exactly will be looking like a Holter monitor. And generally what we have to do means we should record to push a button when patient feels symptoms. Coming to the introduction, this implantable cardioverter defibrillator was first discovered in 1970, and some research had been going on, and in sense mainly it will be signal the atrial and ventricular signals, and it helps to detect and classify the sense signals, and it helps to provide therapy for ventricular and the pace of form. So mainly it helps to pace in case of cardiac resynchronization. And the second type is a subcutaneous implantable cardioverter defibrillator is another option. So here it will be implanted under the skin, that is mainly on the side of the chest below the armpit, and the electrodes will be attached to the breastbone. So this implantable cardioverter defibrillator is larger than a traditional implantable cardioverter defibrillator, and this one will not attach to the heart. So here, this implantable cardioverter defibrillator consists of lead system placed via the subclavian vein into the endocardium, and the battery powered pulse generator is implanted simultaneously, usually over the pectoral muscle on the patient's non-dominant side. And the implantable cardioverter defibrillator, that is sensing system, monitors the heart rate and rhythm, and it also identifies the ventricular tachycardia and ventricular fibrillation approximately 25 seconds after the sensing system detects the lethal arrhythmia. And then defibrillator machine delivers a 25 joule or less shock to the patient. And this procedure usually takes a few hours. So once the implantable cardioverter defibrillator is in place, doctor will test it and program for specific heart rhythm needs. And depending on the problem with the heartbeat, the implantable cardioverter defibrillator could be programmed. So in case, depend upon the patient type, first one is low energy pacing. The patient may feel nothing, that is painless fluttering, painless atrial flutter in the chest when ICD responds to mild changes in the heartbeat. Second, high energy shock. So here, this will be treated for the patient those who are having the lethal arrhythmias, ventricular tachycardia or ventricular defibrillation. This implantable cardioverter defibrillator may deliver a higher energy shock. So this may be painful, and the patient even feeling of kicked in the chest, and the pain lasts for a second, and there should not be discomfort after the shock ends. So in case the patient has a history of coronary artery disease or heart attack and any weakened in the heart and even enlarged cardiac muscle, heart muscle, that is cardiomyopathy, and any genetic heart condition, that is any congenital abnormality that may be a cause of dangerously fast heart rhythms, and any long QT syndrome, and even other conditions that is affecting the heartbeat. And if necessary, that implantable cardioverter defibrillator can be adjusted to reduce the number and frequency of shock, and if it's needed, medication also can be given to make the heartbeat regularly and reduce the risk of electrical storm. Implantable cardioverter defibrillator. And the patient usually need to avoid abrupt movements because that raise left arm above the shoulder, that should be restricted for at least 2 months, and the patient may need to limit driving depend upon the type of ICD received, and you should also instruct the patient for safe to return to driving and other daily activities. So strenuous activities and all should be avoided. And for about 4 weeks after the surgery, the patient has to avoid vigorous above the shoulder activities or exercises like including golf, tennis, swimming, bicycling, bowling or vacuuming, and even heavy lifting and strenuous exercise programs. What are the long-term precautions? So the patients, those are having implantable cardioverter defibrillator, so they have to take some precautions, that is cellular phone and other mobile phone, it's safe. Talk on a cell phone, but avoid placing a cell phone within 6 inches, that is about 15 centimeters. And ICD could mistake a cell phone signal for a heartbeat and slow the heartbeat, so the patient may develop a symptom of fatigue. And security system. After surgery, patient receive a cord, that is an identity cord, and also a handheld metal detectors often contain a magnet that can interfere with an implantable cardioverter defibrillator, and limit scanning with the handheld detector or less than 30 seconds over the site of implantable cardioverter defibrillator. And medical equipment such as if the patient has to undergo MRI or magnetic resonance angiography or radio frequency may not be recommended for the patient those are having implantable cardioverter defibrillator. So better we can move for an alternative test. And while viewing the monitor, the patient may be asked to keep a diary of his activities and symptoms. And the healthcare provider will usually compare the daily, and if they are feeling any changes of heartbeat with the electrical recordings, and try to figure out the cause of symptoms. Headphones and wireless chargers. So because mainly the headphones may contain magnetic substance that can interfere with an ICD, so headphones and wireless chargers should keep at least 6 inches away from the patient. And the second type is an subcutaneous implantable cardioverter defibrillator is another option. So here it will be implanted under the skin, that is mainly on the side of the this implantable cardioverter defibrillator is a small battery powered device and mainly placed on the chest to detect and stop irregular heartbeats in case the patient has any arrhythmias, and for